So Gurpreet, you're 23, aren't you?
Yeah.
Okay, so you fit in the most at-risk age group for chlamydia and gonorrhea. So it's a test that we offer to everyone within your age range as part of the National Chlamydia Screening Programme.
What is chlamydia and gonorrhea?
Well, it's a STI, or sexually transmitted infection, and it's a bacterial infection that lives in the sexual fluids of men and women, and it's passed through sexual contact, so unprotected sex, oral sex, anal sex, sharing of sex toys. It can be passed on through that way. And the important thing with chlamydia is you don't always have symptoms, and if it's left untreated, it can cause infertility in women. So that's why we ask you to do a test now to prevent any complications in the future.
People who do show symptoms for chlamydia and/or gonorrhea can expect to have the following. Women may notice unusual vaginal discharge, bleeding between periods, bleeding after sex, pelvic and lower abdominal pain, pain when passing urine. Men may notice a thick white cloudy or watery discharge from the penis, pain when passing urine, painful swelling of the testicles. Remember, about 7 out of 10 women and up to half of men will have no symptoms at all.
What do I have to do then?
Okay, well, I need to ask you a few questions, one of which was obviously you fit within the age range, you're 23. So in the past year, have you put yourself at risk by sharing any sex toys? Have you changed your partner, had any oral sex, unprotected sex, a split of the condom during sex? If any of those fit that criteria, then we would recommend that you do take a chlamydia test and gonorrhea test today. But again, what would you like to do?
All right, doctor, I think I'll take the test.
Remember, you'll need to follow your Fraser Competence Guidelines if the patient is under the age of 16, that is 15, the patient has diminished mental capacity under the Mental Health Act, you suspect the patient may be at risk.
Okay, all right. Have you had a test before, a STI test before, and if so, when?
No, I haven't done a test before.
Remember, if the patient has put themselves at risk recently, for example, had unprotected sex, they may have been tested and might be waiting for the result, or the patient is still undergoing treatment. Both can take up to 2 weeks.
What I need you to do is fill out one of these forms. So it's all the orange parts that you would need to fill in. So obviously your name, date of birth, contact details, so a mobile is preferable, and then email, and then ethnic origin just to help them. Again, filling in the orange parts here too. So this is actually a sticker label that goes onto the sample that you provide. And this is a card that you can rip away, and it has details of Be Sure there. And then on the back, you've got a QR code that if you scan, it takes you to a video of what happens next.
This is the Be Sure Chlamydia and Gonorrhea testing form. Patients are required to complete as much information as possible in orange, ignoring the grey sections. The barcode is for lab use and represents the unique patient number, or BS number, which can be found in 4 places on here, 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 and here. The first grey box is for lab use only, and the second will be pre-stamped with your unique site code and your address. The third grey box must be completed by the person offering the test, for example, the doctor. In patient details, if the NHS number or GP address is not to hand, it can be omitted. In contact details, we require a minimum of 2 points of contact if possible. Specimen type will usually be either a urine or swab. Pharyngeal and anal swabs are performed in specific sexual health settings and by clinical staff only. If a patient is concerned that their partner may have chlamydia or gonorrhea, then they need to tick this box. We'll offer to notify and treat partners if the result is positive. Under GP use, if you wish to hold a record of the patient being tested, Then complete this section and tear away at the very end of the process. After the patient has completed their name and date of birth, this sticker will need to be peeled off and attached to the specimen tube before the sample has been taken. The final section will tear away and is for the patient to keep. If they haven't received their result within 2 weeks or 10 working days, they can contact Be Sure, quoting their BS number.
Once you've done that, I'll ask you to do a swab sample for me. Now, if you was a man, I'd ask you to do a urine sample.
Could I do a urine sample instead? I don't like the sound of doing a swab.
Totally your choice. The reason why we ask you to do a swab sample is just because it's more accurate for the gonorrhea part of the test. But again, it's your choice.
Okay, I'll do a swab, but the thing is, I'm on my period. Would I still be able to take the test?
That makes no difference. That's fine.
How would I receive the results and how long is it going to take?
Okay, well, it tells you on the back here, on the back of the form. So the results, Be Sure will text you if that's what you've opted for, and you get a message to say you do not need to call Be Sure if it's negative, and then please call Be Sure if it's positive. Now, if it is please call Be Sure message, it doesn't necessarily mean that it is a positive result. It might just be an issue with the sample given. What
about the treatment?
The treatment, again, on here it tells you, for chlamydia, if you call Be Sure, for chlamydia, Be Sure will tell you to go for treatment, and they'll give you 4 tablets whilst you're at the treatment clinic. Now, for gonorrhea, they'll tell you to go to a sexual health clinic where you'll have a course of antibiotics. Okay.
Okay, thanks for your help.
Not a problem.
Remember, if this individual has a positive result, there's a good chance their partner is positive too. Please advise the individual to contact Be Sure for more information. Be Sure will inform clients of their result, offer free treatment, and notify the partners. We offer a full range of advice around contraception and further sexual health testing.